of the brain are working. Check the front part, the cornea is clear. Then we would be looking at the iris to make sure there are no new blood vessels there. They don't have diabetes or something. We look at the angle, which is the area between the blue part of the eye and the cornea, to make sure that they don't have glaucoma. Then we check their pressure by looking to see what their pressure inside the eye is. If it's normal, between 10 to 20 millimeters of mercury is normal. Then we look at the lens by shining a light in to see if they have a cataract. And then we look at the vitreous, which is in the middle of the eye, to make sure there's no old blood from baseball trauma, black eyes when they were young. And then we look at the retina. That we dilate their eye, put drops in their eyes, and see through the keyhole here. If it's a big keyhole opening when we dilate them, then we can see more of the retina. And then we could see if they have the yellow spots, the drusen, if their blood vessels are abnormal from high blood pressure, or they have cholesterol deposits inside the blood vessels called emboli, or their optic nerve looks okay, which is right here, and then the rest of the retina. And then we can photograph it and look at it more deeply. And also, if they do have things already going on, we would do something called a fluorescein angiogram, where we would inject dye in their hand or their arm, and we would take pictures to see what layer of the retina is this problem. Because if it's in the last layer of the retina, this is where age-related macular degeneration is. We will also ask them to tell us more completely what their symptoms are. Maybe it's only once they saw the Wall Street Journal fuzzy. If it's one time it reverts to normal, that's not as so important. That would only be important for thinking about transient ischemic attack, where you have a vascular reason, like maybe you have a heart condition that caused this sudden loss of vision and it came back to normal. But if they consistently look at the newspaper and missing a dot, and we would give them testing to look at that, just to see where that is, that they cannot see.
So you do this very comprehensive exam,
yes,
and let's say you find those drusen and diagnose macular degeneration. What are the options at that point?
First, we figure out how many drusen are there. If it's only one, we say it's not so bad, and we give them an Amsler grid, which is the black and white graph paper where they check each eye, and they are asked to check that once a week and see us if there's any change. We'd see them probably in 4 to 6 months.
But what if you have this patient who's already symptomatic and has a gross abnormality on the grid test?
Okay, and then they usually, on fluorescein angiogram, we would find some sort of bleeding, or old bleeding, or a scar. And given that if it's active, we would recommend one of these intravitreal injections, where we put a small, tiny injection right through here, a little needle, and we could do that in the doctor's office that day or the next few days, and that would probably stop the process and repeat the injection every month. And if there was a problem, they live very far away, Modesto, Fresno, or hundreds of miles away, we could do it maybe 6 weeks or longer, every 2 months. But they need it every month for 3 months, and then every 3 months after. But now the recommendation is every month for a year, an injection.
And what percentage of patients will improve with that treatment?
We found out that there's about 10% that does nothing for, but 90% will show some improvement. Now, I have found in my practice that 90%. In the clinical trials, they found 60%, 60 to 70%, 67% will improve. And improvement means up to 15 letters, which is equivalent to 3 lines of improvement. So that means that if you couldn't see the golf ball, you would then see the golf ball. And if you couldn't pass the driving test, you would be able to pass the driving test. Now, that time for improvement may take up to a year, or if they're lucky, within 3 to 6 months.
And so let's say you have this patient who you then treat, and 6 months later their vision has improved so they can see normally now. They complete their 1-year treatment, and what do you do for them after that?
We still see them. We give them the Amsler grid, and we see them every 3 months. And if they're worse, they're told to come in sooner. And we can still continue to give them shots forever, every month.
So thank you very much. We'd like to maybe review the take-home messages for the audience today. We only have a few minutes left. What would be your message for our audience?
If you're over 55, see your ophthalmologist and maybe drop in a retinal specialist's office, because we need to see you to make sure you don't have this problem, age-related macular degeneration. And if you have family members or loved ones, take them in to see a retinal specialist, because the treatment has radically changed in the last 2 years and the improvements are just tremendous.
Well, thank you very much. I think these are very important messages for the audience. Routine eye care is essential to be received from an ophthalmologist, a trained physician who can do a complete comprehensive exam, not only of the front of the eye, but as Dr. Wu has described, the back of the eye, the retina, has many things that's going to impact your vision. And macular degeneration, which has lots of causes that seem all related to probably blood flow, will injure the back of the eye. And for those that lose eye vision from the bleeding associated with that and so forth, there's now very effective treatment.
Yes.
And this treatment now is because of advances in management of growth factors, very sophisticated drugs that can now be delivered in your office with excellent results. And so I think that's very exciting news for our audience. And I want to thank you very much for joining us today.
Thank you.
And we enjoyed everyone's attention here at KSIR, and would like to invite you all to support this community program, and we hope to see you in the near future for our other shows.